Hi everyone, 11 o'clock Eastern time. It's Monday. How you guys doing? I put my hair like this so you couldn't see how gray my hair was getting. I tried to dye it with some CVS dye, and what can I say? It didn't really work. So thanks for joining us, everybody. We're having a really important conversation. As you know, I've been checking in with a lot of healthcare providers, people on the front lines, and I'm talking to us with COVID. So she's going to give us some more insight on what they're seeing. Hi, Megan. It's Katie. How are you?
Hi, Katie. Good, thank you. How are you?
I'm good. Wow, this is you. Boy, your picture is crystal clear. I know you're an expert in digital health, and I have to say it's showing because it's working. And a lot of people are joining us. They'll be in progress, so I'm going to repeat maybe a couple of times, Megan, who you are and what you do. But first of all, thanks so much for spending some time talking to me this morning.
Thank you. It's my pleasure and honor to be here with you, Katie. Thank you.
Well, thanks. And I know you've been so busy. I'm going to explain. Megan is an emergency doctor at Brown Emergency Med. She's also has a master's in public health. She's an associate professor in the Department of Emergency Medicine at Rhode Island Hospital, Albert Medical School at Brown. And she has really been on the front lines and very outspoken about what doctors and medical staffs are experiencing during this unprecedented time. So you started Get Us PPE, and I know that this is continuing to be a problem. I talked to a friend of mine who's a nurse who told me she gets one N95 mask a week, and it used to be one per patient. So tell us a little bit about Get Us PPE and the status of personal protective equipment for all the medical professionals out there right now.
Yeah, so we started Get Us PPE a little over 2 weeks ago now. A friend of mine, Esther Chu, created the hashtag #GetMePPE when we started getting reports from our friends and many of us from our own hospitals that we were running out. At first, we thought that someone was going to magically swoop down and provide us with all the protective equipment, the masks, the gloves, the hand sanitizer that our hospitals so desperately needed. And it became really clear over just a couple of days that there was no magical savior that was going to come in and get this to us. And so we kind of looked around and said, we've got to do this ourselves. Like, we have to obtain protective equipment and distribute it for our colleagues across the country. We're on the front lines, but so are thousands and thousands of other people, doctors, nurses, respiratory therapists.
Even janitors,
yeah.
And the people who prepare food for the patients. I mean, a hospital is like a mini city. And so when you think of healthcare professionals, you really have to think of the big picture.
Absolutely. Yeah, totally. We are an absolute team, and our team is only as strong as everyone in it. And so it's about really protecting everybody. I remember with one of our first COVID patients watching housekeeping go into the room and clean, and my thinking, oh my God, I get to take care of them and step out, but they're in there cleaning all the surfaces and putting themselves absolutely at risk.
So what's the situation, Megan? Are you getting more of the equipment? I know there's been controversy about the stockpile, the national stockpile, and there's been some controversy about companies that have been charged with producing more of these or manufacturing more of these for U.S. healthcare providers. So can you just give us the update?
Yeah, so the update, there are some, the national stockpile has been almost entirely distributed and depleted. Almost all of it has gone to New York City, appropriately, right? Because it's kind of a disaster zone right now.
Right.
And my colleagues there need it. But there's pretty much nothing left nationally. Now there are some folks stepping in, like Mr. Kraft, the owner of the Patriots, flew a plane to China.
He had a whole, brought $1 million back from China in a private plane.
Which is crazy that he had to do that, but he did, and it's amazing. And in Rhode Island, we've gotten some of that. It's gone to the Massachusetts hospitals, but there are a lot of places that still have nothing. And the market right now, Katie, is an absolute mess. I spent most of yesterday on the phone trying to find manufacturers from whom we could use donor money to buy PPE. And we've succeeded in some small amounts, but there's just so little out there, which is why we're also focusing on trying to link donations of existing PPE to hospitals in need. Like the Indian Health Service has virtually nothing, right? So like, how can we take stuff that's already out there and match it to people that need it? Because there just is so little supply, and there's so many scammers out there right now too.
So, yeah, they're scammers, which is terrible when you think about that people are taking advantage of that situation. But do you feel like it's getting better, or is it just still kind of a big mess?
It's still a big mess, honestly.
And
It is.
is there something that people can do to kind of help, or is it just, is this just a question of bureaucracy, you think, Megan?
So there's a couple things. I think people can help, honestly, by that physical distancing, by staying home, because the less that you get sick and the less that you have to come to the hospital, the less that we have to use up the limited protective equipment. So that is honestly a huge help. People can help by, I know people have been sewing masks and gowns. Those masks, particularly for like grocery store workers or pharmacists, can be a help. And then people can help if they have donations in their house. If we've had people reach out from dentist offices and nail salons who are providing equipment that we can distribute to folks across the country who are most in need. So that's another way people can help.
Someone mentioned that farmers use a lot of these masks, and that actually one of my followers DM'd me about a contact with like some farmer consortium that they could maybe give some of their masks to you all as well.
Oh, that would be amazing. I mean,
I'll look
Katie,
at
we
it
have over,
yeah. Anyway,
we have over 3,000 healthcare facilities in need, many of whom have like nothing left.
Oh, that's terrible. Well, we've got to, I mean, as they ramp up production, and we hear 3M is ramping up production and other places, is this a question of it just a time lag between when they get them and when you guys can have them in your hospitals?
Yeah, it is. So there is a time lag. So as they ramp up production, it's going to be 2, 3, 4 weeks until that shows up, right? That's not helping New York City right now. And there's also a lack of the raw materials that are needed, particularly for those N95 masks. Every country in the world is trying to buy these right now. So it's we really need to kind of ramp up quickly in the US. I've been in discussions with some American manufacturers who are trying to retrofit, and I think that's just awesome because it's going to keep Americans in jobs and provide PPE to our frontline healthcare workers, but it's going to take a little time to get there. So right now we really need those farmers' masks and construction companies and stuff like that.
Do you feel like we could have been better prepared, or it's just that it's impossible to really prepare for something like this? I'm sure you have some views on that.
It's a mix, right? I think none of us alive have ever been through something quite like this before, but it was not impossible to predict that this was going to happen, right? We had a pandemic response team. We knew that something like this was going to happen someday, and I think we could have been better prepared. And we could have reacted, if we weren't reacting when the first case happened in China, we could have reacted when there was that first case in Washington State and pushed domestic manufacturers to start producing then.
Right. I think
we could have been in a much better.
I think there's probably going to be a commission like the 9/11 commission that will study this, and how state and local and the federal government could have worked together and coordinated better. So that'll be really interesting, but I think a very important learning from this terrible situation. Let me ask you about patients, because I think a lot of people watching want to know what you're seeing on the front lines. And I know you've been talking to doctors all over the country through your effort. And can you just describe, if you could, what people are in the healthcare business or healthcare profession are experiencing?
So people in healthcare are feeling a lot of things. The first is fear. Because of that lack of protective equipment, we're putting ourselves on the front lines and are worried that we're not going to be okay. I have dozens of friends that have already been infected with COVID-19. My text messages are full of people that are wondering if they have it. So we really are feeling fear. We're also feeling pride and teamwork, that we're able to be there and help support patients in their time of need. But it's the craziest thing, Katie, because the science is moving so quickly. We know so little about how best to care for these patients. So it's really uncomfortable. Normally, I've been a doctor for 16 years now. And normally I have like evidence behind what I do. And here we're literally learning day by day and changing our
No,
protocols.
that's so interesting. I have a lot of good friends who are doctors, I think through my cancer advocacy work primarily. And one friend of mine said, just to that point, there isn't medical literature that they're trying these drugs just because maybe the last patient responded well. And it's learning how to treat this disease in real time, which puts an incredible amount of pressure and stress on the physician, right?
Yeah. Yeah, it really does.
Are
It
are
is
these are
so.
these drugs working, Megan? The hydroxychloroquine, and I think there's another drug. There've been I know some immunotherapeutic drugs that they're looking at because I'm very involved in that for cancer. Um,
Yeah.
what are these drugs working? And they're not without risk too, right?
That's exactly right. So the hydroxychloroquine, there's like a very small study that says maybe it makes a difference for people in early stages of the disease, but like maybe it doesn't. So we're still kind of waiting on that one. It's certainly not a last-ditch drug for people who are super sick. Gilead has made a drug that they're making available for free to really sick patients that we're trying to study.
Is
There's the
is
plasma
that the one with
therapy.
is Gilead the one with the R?
Yes, the remdesivir. I don't want to mess
Yeah,
up. Yeah.
yeah.
There's some options out there that we're trying, but this disease is unlike anything that we've seen. Our discussions in our doctors groups and nurses groups it's a weird disease, the way that people get really sick from it. And so we're trying to throw a bunch of stuff, but at the same time trying to do it within studies so that we can take better care of the patients before us. So I don't want everybody to go out and say, oh, I need chloroquine, because A, it might hurt you, and B, we don't know it works, and C, if everybody just goes and takes it, then we won't know if it actually does help. And it might deprive people, from your work, it would deprive people with lupus or rheumatoid arthritis or other
Right.
diseases that really need it.
That's right.
So,
I was reading about that, about people with lupus needing that drug, and also the fact that it really does need to be studied. But I think when you're trying to save lives, it's hard to say that you have to have kind of a risk benefit
yeah.
analysis with every patient, right? And anyway, it's just incredible stress. One of the things I wanted to talk to you about is you're seeing African American patients being affected more severely, and these are not necessarily older African American patients. And talking about sort of a racial divide that is surfacing. Is this because of environmental factors like obesity, or some people say poverty is a comorbidity, or do you think could it be some kind of genetic consideration? That's a big question, and I'm not even sure that you have any kind of insight into this, but what do you think?
It's a really tough question. The initial numbers didn't report breakdown by race, and obviously Italy and China don't have a large population of Blacks or Hispanics, and so we're just trying to look at what are the racial disparities. But it's not surprising to any of us in medicine that we're seeing Blacks get affected more commonly, because there is in the United States, right, where folks, if there's so many factors. It certainly may be related to socioeconomic status, or to living close together, or being in a service job where you can't stay home and protect
Right.
yourself. It might also be related to having to kind of the higher rates of diabetes and hypertension in the Black community. But it's so tied into all the environmental factors and all the historic factors in the United States around care. But that's something we're just starting to look at and try to address.
In fact,
I think it's.
Oh, I'm sorry. I was just going to say we have an initiative at Stand Up to Cancer, Megan, where we're really studying the impact of certain cancers on people of color, because for so long, I'm particularly involved in colon cancer research. For so long, we saw that African Americans were more prone to being diagnosed with colorectal cancer. And yet when I would ask experts, why is this the case? They would never know. They would just say, we don't know. And I'd say, is it socioeconomic factors? Could it be a genetic, there's sometimes, genetics, and we're learning so much about the human genome. So I think it's such an important thing to study because we can't really understand the impact of drugs and we can't understand medicine until we study all populations.
Exactly.
Oh,
Totally,
someone just
totally
pointed
agree.
out something interesting. I love my smart followers. ACE receptors may be different in African American populations. Do you want to take a shot at it? I just read about this, about ACE receptors, which I thought was, oh, ACE2 receptors. See, I have the smartest followers. I love you guys. So, Megan, can you explain for those of us who aren't as smart about what ACE2 receptors are?
Yeah, so the ACE2 receptors are receptors that bind something called angiotensin, which um, changes kind of risk of hypertension, et cetera. And so we actually prescribe slightly different hypertension medications to African Americans as a first choice than to white or Hispanic Americans because of difference in those receptors. The COVID-19 virus, part of the way that it works is through those ACE2 receptors. So we are thinking that there may be some genetic differences there in who's susceptible. But again, it's like this virus has been around for like 3 months and people are working at breakneck speed to try to get results, but we just don't have definite answers yet. So it's a lot of hypotheses that we're trying out. But I want to be able to provide data and assurance to people, and I just don't have that yet.
Right. And if I had to describe ACE2 receptors, isn't it something, okay, I'm going to try this, but are they cells in the lungs in particular, Megan, that have some kind of coating, protective coating, or did I read that wrong?
So there's a bunch of different parts. So the ACE2 receptors are on a lot of different cells, and
But
they're
I
a
guess
way.
does the COVID
The
attack
COVID,
it?
yes, exactly, binds in the lungs, and that it's thought that it may kind of increase permeability and increase its ability to kind of destroy the cells and create that immune response. But it's still, yeah.
It's still unclear.
Yep.
Someone asked, they said, my daughter is on Remicade. Will that protect her from COVID?
No, so Remicade, unfortunately, may increase risk of COVID because it is an immunosuppressant. That said, again, we don't totally know. There's some people that think that COVID is really bad because it increases your immune system, but there are others think that when you're on immunosuppressants, it increases your chance of catching it. So don't totally know, but I would say that for your daughter on Remicade, it's really important to practice that physical distancing and hand washing and mask wearing.
Okay, that's a good point. And by the way, yeah, can we talk about the immune system just for a moment, Megan?
You can try.
Okay,
I'll do my best.
Well, of course, immunotherapy and cancer is all about revving up the immune system to squash the cancer cells, right? And it seems to me there are two responses to COVID-19. This is me acting like a sort of drugstore physician. One is your immune system in certain patients isn't strong enough to fight it, right? Whether they're elderly, they have underlying conditions, comorbidities, whatever. And then the other is your immune system is too responsive and it causes what's called a cytokine storm.
Mm-hmm.
And so there are two situations that are at play. Is that accurate?
So to the best that we know, that is accurate, but there's a third thing that we're starting to notice, which is that a lot of patients with COVID-19 are getting little teeny blood clots, which we think might be causing some of the trouble with the lungs, might be causing, we're seeing people with like bleeding disorders because of this. It might be why diabetics are at higher risk. It's a really early theory that people are just starting to examine, but we think that this kind of hypercoagulability or like little clots in the lungs or in other organs might also be part of causing this.
And
so we're still.
Who's susceptible to those, Megan? The little
blood
clots?
Mm-hmm. So people with diabetes, with heart disease, if you get lots of little teeny blood clots and you already have a bad heart, or you already have vascular problems, right? Because you have diabetes and you have poor circulation in your legs or elsewhere in your body. And then you get these little microscopic blood clots blocking off blood vessels. That might be part of what's driving this inflammation and driving some folks being at really high risk. It's still a theory, but there is some early evidence to support that as being part of the cause.
Oh, that's fascinating. And when it comes to this cytokine storm, will you explain what that means? Because my understanding is just increased inflammation that creates problems in the lungs, but that's about all I know. Can you
I think
explain
that's
what
actually
that?
that's a really good explanation, Katie. I think when you think about cytokines, they're things that get released from your body normally to try to fight off stress or inflammation or infection. And a cytokine storm is when your body releases so many of these little molecules that it kind of wreaks havoc on your body. So it's you just get way too much of it all at once. It's like the difference between my eating a bite of chocolate cake and having an entire cake. That
Right.
entire cake is going to kind of overwhelm my body. And so we think that some people are susceptible to releasing far too many of these molecules. And then again, it kind of makes your whole body go haywire and not work the way that it's supposed to. Causes inflammation in the lungs, the brain, and other parts of the body.
So it's like when your immune system is on steroids, so to speak,
Yeah.
metaphorically, when it just is ramped up so much that it causes all the inflammation. It's actually your immune system that's causing the problem instead of the pathogen or the virus itself.
Exactly. That is what we are thinking, but we haven't seen yet that some of the medications that reduce immune system response help. And so that's one of the things that's confusing about this,
Yeah,
is that
I
we
bet.
still haven't found something that actually really works to reduce that. And a lot of the therapies that we use for people that are in sepsis, right, which is like an overwhelming infection of your bloodstream, a lot of the therapies that we usually use for that just aren't working to get people better the way that we're used to. Again, it's a weird, when they call it a novel coronavirus, we're not kidding. Like its effects on the body are truly novel and like nothing that we have ever seen before. We're seeing people walking around with, for anybody on your feed who's an asthmatic, right there, or has COPD, they're used to watching their oxygen saturation. And, we get worried in medicine if your oxygen saturation is below like 90%. We're seeing people walking around with sats of 70, 80%, not feeling like they're short of breath. It is, and yet their body is starved for oxygen. So there's these very strange parts about this disease that we're trying to figure out as quickly as we can. We're doing Facebook groups, we're sharing information on social media with each other to try to help each other out. But it's just truly a strange and baffling illness for those of us on the front lines.
Someone just said, tell people to not stop antihypertensive meds.
Thank you. Yes, you don't. So like the ACE inhibitors, so for people that are on like lisinopril or things like that, or angiotensin receptor blockers like losartan, you don't want to stop taking those because you could put yourself at higher risk of other problems. And Katie, that is actually a really good point, is that one thing I'm worried about is all of my patients with normal medical problems who are
Mm-hmm.
scared to go to the doctor or scared to come to the ER. I still want to take care of people if you feel like you're having a heart attack or appendicitis. And I still want you to do your normal wellness medications. Take your diabetes meds, take your blood pressure meds, take your, whatever it is that
And
you're on.
are people not doing that because they're worried, because they're hearing so much
Mhm.
information? They're afraid that that's going to put them at higher risk, right?
That's exactly right. And I'm seeing people show up in my ER and other ERs who've not been doing their normal medications and follow-ups because of fear around COVID, which then creates a whole nother set of problems. So I do want to encourage people to stay in touch with their doctor and keep doing their normal medical care as best they can.
And I know a lot of people are asking about their various situations, and if their current conditions put them at higher risk, like immunomodulators put you at higher risk. Someone just asked about something, dermatitis, which I couldn't read. I think the best advice is to ask your doctor, right? I mean,
Yeah.
you
And
can't give advice to everybody about their particular medical situations.
that's right. And I think asking their doctor, and also, I think things like this Facebook Live, Katie, make a huge difference because there's just so much conflicting information about how to protect yourself and what to do if you're feeling sick. Part of it is that we don't have good science yet, but part of it is.
Hold on, we just are having a little.
Oh, the joy
Sorry.
of the internet.
Yeah. But this is unbelievably clear. I've been doing some of these, Megan, and they just turn into a mess. So this is
Well,
super helpful. I mean, go ahead. Sorry.
I was going to say, none of my kids are on Zoom right now for distance learning, so that's probably helping.
Good. Yeah, I tell everyone in my house, please stay off the internet. Well, what else can I ask you about that might be helpful to people who may be watching this? Is there any, obviously we like to repeat about social distancing. People are worried about going outside. And I mean, my feeling is that people should get outside. They should probably wear a mask, right?
Mm-hmm.
But I think for their mental health, like for the first time in a while, it's really sunny out where I am on Long Island, and I'm going to take a walk or just sit outside and get some vitamin D.
Absolutely. So I think getting outside, doing things, so which is a great point, Katie, and I would love to talk about, is protecting your own, not only physical health, but also mental health. And we know that getting exercise and going outside and connecting to other people, things like this,
Yeah.
are so important. So yes, getting outside is great. Maintain that 6-foot distance from other people. And your point to wearing the mask, that is what the CDC is recommending right now. Not
It's
so
so
much to
funny
protect.
it's so funny that changed over a month. That at first it was like, well, it's not going to help you at all. Then the National Academy of Sciences came out, and then the CDC and the WHO. It's like, can't they get together and make decisions on this stuff? But I guess it speaks to how crazy this is, right? Because they're
It,
learning on the job.
That's exactly, they're absolutely learning on the job. And I think there's a lot of fear. We don't want to take masks away from those of us on the front line,
Right, I
right?
agree.
So we're telling people, like, wear that homemade mask. This is where sewers can be a huge help, but it's more to protect other people from you than to protect yourself. It really is, because so many people are carriers and don't know it. And because testing is not widely available, the point of wearing that mask is that if you cough or sneeze or breathe and you happen to be a carrier of COVID-19 and you don't know it, you're not going to get other people around you sick.
Can I just ask you, I know you talked about this, but yesterday, President Trump doubled down on the benefits of hydroxychloroquine, and very strong signs that it's effective in treating coronavirus. I mean, you're on the front lines. Are you seeing that it's very, very effective or not?
So we're not seeing that it's effective at this point. Again, there's this little study that says that maybe it decreases the length of time that you have coronavirus if you take it really early on and you're someone with no other pre-existing conditions. But that's not enough for me to go out and prescribe it to everybody who comes in with COVID symptoms at this point. There are side effects. Now, those side effects are not common. For most people who take this drug, it will be safe. But it's not that there are no side effects. This is not water. This is not harmless. And so, we're not seeing right now that it's making a difference, but there are trials going on. So for people that are thinking about this, particularly for frontline healthcare workers, there are a couple of big studies, one's being run out of Minnesota, to enroll people to see if it works. And so I would say, look and see if there's a study in your area, participate in that, and help us take better care of other patients by helping us see if it does work. If it works, I'll be all for it. But I'm not ready to go and prescribe it to everybody yet.
Okay. And what about health, your brothers and sisters on the front line? I worry about your emotional, mental health. The fact that I've read, and I know you've talked about this, Megan, people writing wills, doing videotapes for their children. It's just absolutely heartbreaking. I saw something last night where a woman said, my children are too young to really know me, but if this virus takes my life, at least they'll know I was doing everything in my power to help people. And it just broke my heart. And what is the sort of the emotional state of all the healthcare providers?
I think that quote just personifies our state, which is that we are terrified, but we also feel like it's our job. Listen, Katie, I was texting with my sister yesterday, who is a doctor actually in another country, and was like, I have body aches. What if I have COVID? Do I have to separate from my family? And luckily she got tested and she's fine. But it is terrifying, especially because we don't know the risk factors. We've seen our own colleagues get intubated and die. And
have you lost any colleagues?
So there's one emergency physician who died last week. But none here in Rhode Island. Thank God. Thank God. Not yet.
Yeah. But I mean, one emergency physician in the U.S. or because
so one emergency physician.
Yeah.
So he was actually an emergency physician who practiced in New Jersey, but lived in New York City. and had some symptoms, stayed home, and then just died suddenly, which is so scary. We've had other ER docs who've been in the ICU and have been okay so far. And certainly there are a bunch of nurses. There's a bunch of nurses who've been really, really sick.
I know, and I think that's what's so scary is that for all the advice, stay home, don't worry, and you could get sicker and you could get more exposure in the hospital. I also think it's really scary that you can just suddenly turn and things can go downhill very, very quickly. And I think that leaves people really confused about when they need to get help.
I agree. And that's, there are no great guidelines, again, because we don't have great science. And so what I tell folks is if you are feeling sick, call your doctor, use telehealth, right? But if you're scared, that's what the ER is for. I mean, I don't want to scare people away from coming in. Can use telehealth before coming into us, great. But we're there 24/7, 365 days a year. And that's our goal, is to try to make people safe and to do the best that we can. Unfortunately, because of that lack of science, it's really tough to tell people exactly when. You know, it's not like with asthma or with cancer where I can say, oh, here's the time where you need to come into the ER. We don't totally know yet. But I say for people to listen to their bodies. And again, to try to use telehealth as well for that first assessment.
Somebody was asking, a lot of people who watch these have asthma, and someone was asking about Flovent or using her nebulizer as a preventive measure. I have to read these comments very quickly, but any advice for people who do have asthma?
So for people who do have the asthma, the biggest thing is to keep your asthma under control. So keep on all your normal medications. The nebulizer, I wouldn't use it preventively. Use it for treatment if you're having an exacerbation. One of the tough things about this disease is that there's some signs that maybe taking prednisone, which is part of our normal treatment for an asthma exacerbation, might make it worse. Again, it's that thing about the immune response where we're not sure yet. Prednisone suppresses the immune response. So we're trying to be super cautious with asthmatics. So anything you can do to avoid having a bad asthma attack, avoiding pollen, avoiding other illnesses, that hand washing is helpful. But I wouldn't stop any of your normal meds.
And before we go, just as a doctor who's seen so much, because I know you've got a lot to do and you've been so generous with your time, but what are you doing with your grocery situation? You know, my mother-in-law sent me a video a couple weeks ago, some doctor somewhere doing a whole demonstration on YouTube about your groceries. And you know, I haven't been super diligent about washing things from the grocery store. I've stopped going to the grocery store because I'm 63 and I make my 57-year-old husband do that, or my daughter. But what is your strategy on groceries?
Yeah, so I too am not going to the grocery store because I'm working in the ER and I feel like could well be exposed, and so I don't want to expose other people. But for folks that are going, my husband is also the one that's doing the shopping right now. So he is obviously wearing a mask. He's being very careful when he's at the store to maintain 6-foot distancing. Touching things in the store, being super careful to not touch his face, right, or his hair or anything around him because that could get him infected. And then as soon as he gets home, washing his hands. We take everything out and we honestly try to not touch like the containers for a day or two because evidence shows that the virus dies within 2 to 3 days on kind of normal containers. But we're washing or Lysol wiping anything that we need to touch immediately. So if it's fruit or veggies, we're washing it. If it's like a milk carton that we're all out of milk, then we try to wipe it down with a Lysol wipe before we touch it to reduce the risk of infection.
But if not, you leave groceries outside.
Yeah, leave them outside or leave them in your, if you have a basement or if you can leave them somewhere in your house and let them sit for a couple of days before you touch them, that's going to decrease your risk of getting infected. Again, there's not a lot of reports of people getting infected from the mail or from going to the grocery store, but we also just don't have the science. So I feel like this is a place to practice caution.
Well, I think the big mystery is if you do get diagnosed, it's like, who the heck knows how
Right?
it happened, right? Did you get it because you talked to someone, or did you touch a surface and then wipe your nose, which, I'm always touching my nose because I feel like I always have a runny nose and I have to stop doing that. So I think there's just so much that we don't know about this disease, which, people like you are learning every day. This has been so helpful. If you could join us again, maybe at some point, Megan.
I'd be honored.
I mean, I'm so interested in science, and I'm so grateful for you and everyone else who are putting their lives at risk every single day. And I think, as I said, I have very smart followers. Yes, do you wash your fruit and veggies with soap?
That's a great question. So yes, I do.
Okay.
So yeah, because the soap is what breaks up the lipid envelope around the coronavirus.
Right. I guess that, I saw that the virus itself has this sort of greasy casing, and that's why soap and water is really so important.
Mm-hmm.
Well, listen, get sleep. Please take care of yourself. And maybe we can do this again, because you're fantastic. You're a fantastic communicator, and I think people really. I'm not sick. I'm just thirsty.
I know, Katie. Take care of yourself.
By the way, I'm so. My husband every morning wakes up and goes, "I think I have a headache," or "I think I may have a sore throat." I think there's a lot of. This does a lot of head games to you, right? How do you stop yourself from driving yourself crazy?
Oh, Katie, that is the biggest question of all, I think, for all of us right now, right? We are separated from everything we normally do to make ourselves feel better, right? I can't go out and get a glass of wine with my girlfriends. Yeah. I can't go see my parents, right? Normally I do Sunday dinner with my parents, and I can't do that right now because I don't want to put them at risk. So for me, it's a few things. One is exercise and getting outside and getting that fresh air. A second is connecting. I mean, this is absolutely lovely. I've obviously never met you before, but this is terrific. But like yesterday, I did a Zoom with my college roommates. We're all across the country, and we did an hour where we kind of did Zoom and drink coffee, and that helps decrease anxiety. And
I'm doing that tomorrow night with my high school friends.
Oh, that's awesome.
It's so
good
fun.
For you.
Yeah.
Right? So stuff like that. And then, if you're someone who meditates, if you're someone who prays, if you're someone who has kind of other things, baking, right? Whatever it is that makes you feel good. And then the last part, I think, is doing things to help others. So part of how I manage my anxiety is through getusppe.org, because I know that I'm trying to help my colleagues. It might be sewing, it might be writing letters, it might be, a friend of mine dropped off a bottle of wine on my front step, which was lovely. Chalking your driveway, doing something that makes you feel like checking in on your elderly neighbors with a note. Stuff like that, I think, is so crucial for helping us to feel like we're in control right now.
I agree, and it kind of gets you out of your own head. If you can, even checking on a friend, like I have a lot of friends who are single, who are by themselves, and I'm just checking on them. And there's an elderly gentleman who lives nearby who I met outside the drugstore last summer and gave him a ride home, and we check on him. We were going to bring him some daffodils today and just put them outside his door. I do think that, and someone said scriptures are very helpful. I think if you're a person of faith, that can help. But by the way, I'm sorry to go off on this quick tangent, Megan, but these churches that are insisting on gathering for Palm Sunday and these governors that aren't taking the right precautions, I think that is so disgusting and selfish and weird. For Christian people, or people of faith, whatever faith it is, to not heed the warnings of our scientists and our medical professionals, I find it really infuriating and upsetting.
I'm with you. I am just horrified by it, because it's going to create these centers of infection. We saw there was one funeral that was held that led to like 40 or 50 cases in one small community. And it's just not fair to the parishioners. It is a selfish thing to do to continue to hold those large gatherings and put the entire community at risk. It is the opposite to me of being a person of faith.
Well, Go ahead.
Pope, I was going to say, the Pope himself is doing mass, separated and remotely. And, my governor, Gina Raimondo, who is a Italian Catholic, talks about how, her the bishops and her mass is being done remotely. And I know this is a tough time of year, whether it's Easter or Passover, to not be able to celebrate with your family and your faith community. But you want to keep folks safe, right? And I think it's selfish to not practice the physical distancing right now.
Well, I think there should be a federal mandate, but hey, I'm not in charge.
Me neither.
Yeah. Well, listen, thanks again, Megan, and everyone who joined us for this conversation. I always love to help my followers or help people get more information. If you guys want me to talk about any other things, I have access to incredible experts like Megan. So let me know and we can try to organize these. I'm talking to Robert Reich this afternoon, Megan. I've always been such an admirer of Robert Reich's, and we're talking about the class divide that has become intensified by this experience, because so many people who are living paycheck to paycheck, I think, there's such so much income inequality in this country, and I want to talk about what people who are really, really hurting are experiencing and what we can do to help those individuals.
Oh, I love that you're doing that. And on behalf of all of my patients in the emergency department, thank you for covering that, because, and we can talk about that another time, but that is a huge issue. I am worried about people who are, were living paycheck to paycheck even in a good time and are now completely, without anything and can't afford their meds, can't afford their rent, can't afford their food. It is a terrifying time for folks' mental and physical health. And I think helping people with food, with those money for groceries. And then I'm also worried about my patients who are in houses with domestic violence or child abuse.
Yes. Well, I do have a newsletter called Wake Up Call. I hope that you'll subscribe to it, Megan,
I will.
Because you can go to katiecouric.com, and we had a story about that last week, because I'm trying to stay actually on top of the way this story is unfolding. And it's funny because CNN then invites a lot of the people I find on their network. But I think that's such a critically important issue, because domestic violence, I mean, listen, it's very stressful and difficult for people who have solid marriages, right?
Right.
And you think of these other things that exacerbate this problem. And are you seeing that? And
yeah, we are. Across the country, we're seeing increased rates of both domestic violence and child abuse, because you think about it, there's no one to check on you, right? There's no one. Normally a kid goes to school, or a woman goes to work, or people notice that they're not showing up, right? And notice maybe that there are bruises or that they're not acting like themselves. And you've lost that social community. You're totally isolated. It is a terrifying time for folks that are living in homes with violence.
Yeah, I didn't even think about child abuse. We should do something about that, because that is really, that's so hard. I mean, it's also heartbreaking, but that's something that needs attention. And I don't know how could we fix that during this time? What can be done, you think, Megan? Because maybe there could be virtual social worker visits, but that's hard, right?
It is hard. I think that having virtual social worker visits, I think that things like your discussion with Robert Reich about how to help people economically, because we know that when people are stressed out because of economics, it makes people who are kind of on the edge and have tendencies towards violence, it makes them worse. I think that having ways to have teachers stay in touch with the kids
and
they know,
probably,
and
right?
Right, because the parents are often sick, or there's often kind of other stuff going on, whether it's substance use, and then I think it's supporting these nonprofits like homeless shelters, domestic violence shelters. Child abuse and domestic violence so often go together, and so continuing to provide ways for it's usually women, but sometimes men, to get out of an abusive relationship.
You think about this has a cascading effect into so many aspects of society. And, think about the abused wife who wants to escape, but there's no place to go now.
Exactly. And so I'm donating to our local domestic violence shelter, which is still providing services.
I'm going to do that too.
And I think that's just critical, is providing them with the ability to continue to do outreach and have services out there. I think a lot of us in the kind of public health sector are trying to really quickly change our usual strategies. So your question of how do we prevent it? still trying to figure out kind of the best way in this world to do it, but we're trying to quickly kind of change what we're doing and how to reach people.
Right.
Yeah.
Well, this actually is right in your wheelhouse, Megan, because you study domestic violence, you study digital health, the intersection of that with public health. So I think, this is an issue that's going to need a lot of attention if this happens again, and how to deal with it. So, there's somebody said they watched the trials of Gabrielle Fernandez on Netflix, and I can't even watch that. I've heard about it. Some friends of mine have watched it, and it's just so heartbreaking. Anyway, I've taken enough of your time. I feel like I could talk to you all day, Megan.
Same.
But let's stay in touch, and if we can be helpful to you, if you need to get the word out on anything, for patients, for people who are at home, if you have advice for them, maybe you could write something for us for our newsletter.
Be honored.
And we'd love to just stay connected with you. And again, thank you for everything you're doing on behalf of everyone watching and everyone who kind of gets information from me. I can't tell you how appreciative we are.
Thank you. Vice versa. I am so appreciative of your doing this and helping your followers and the folks that are kind of watching, and I'm really, really appreciative, Katie. Thank you.
All right.
It's a team effort.
Yeah, it is. It takes a village. Anyway, Thanks again, and let's stay in touch. And thanks everybody for watching. I hope this was helpful. Let me know, DM me, and I'll see you soon. 2:30. I'm talking to Robert Reich. If you're not busy, or if you want to tell some of your colleagues if they want to watch, we're going to be having that conversation.
I'll pass it on. Thank you.
Okay. Thanks, Megan. Thanks, everybody. Bye.